Anesthesiologists of Reddit, what's the most disturbing thing you've heard from a sedated patient? I was coming out of anesthesia for an arthroscopy and I tried to rename the nurse assigned to keep an eye on me. I asked him what his name was, and when he told me his name was Scott, I said Mike. No, Scott. So, your name is Mike. My name is Scott. Mike. Scott. No. Reverse. Was going under for an emergency DNC and my anesthesiologist had a Russian accent and the last thing he said to me in his very deep and menacing Russian voice whilst towering over my head at a staggering 6'7" was "Now you go night night." I'm a nurse but this happened to me as a patient. Bit gross, but here goes. I had a terrible tonsil infection and it abscessed, and it was occluding my airway. It was so incredibly painful, and I was breathing like Darth Vader. The ear docs were going to try to manually drain the infection from the tonsil to open my airway and avoid a tracheostomy. I was terrified. They gave me some Ativan and fentanyl. Now fentanyl is really powerful pain medicine. Just takes a smidgen to do the trick. They had me in a dental chair for the procedure because if they had laid me back I would have suffocated. Anyway, the nurse, bless her, gives me the fentanyl and is watching over me with my mom, also a nurse. Apparently I started sliding out of the chair, and as they run to catch me, I mumble "No wonder people steal this shit," then flake out. Medical student. On attachment with a stomach specialist, gastroenterologist, couple of years ago. Let me set the stage. 13-year-old kid in for a colonoscopy, sticking a tube with a camera at the tip up the ass, cause he's been having diarrhea and some blood. My friend, girl, relevant later, and I join in to watch. Trying to reassure the kid, the doctor tries to tell him it's fine. He brings up the fact that the kid is a fan of WW2 documentaries and says the father told the doc that the child spends lots of time on the computer reading up on WW2. I'm convinced otherwise. But nevertheless, kid calms slightly and agrees to lie on his side and open wide. So we begin. The kid is sedated, becomes drowsy, then in we go. What I see on screen can only be compared to the scene in Southwestern Ep 4, when they come out of hyperspace in the remains of Alderaan. The child, writhing in pain, starts mumbling. My friend and I swear he said "luffed" something and other strange words. And then, as my friend goes to comfort him, he screams "Don't touch me, whore." I'm in no state to help, biting on my fist to stop laughing. It takes about 10 to 20 minutes and we are done. As we wheel the kid out, he raises his left arm and say "Heal Hitler" before going back to sleep. The end. Once my mom had surgery, and when she was waking up from the anesthesia, and on a whim decided to fuck with my dad, so as she was regaining consciousness she bleary looked at my dad and said "Who are you?" My dad didn't take it well, but she still laughs about it to this day. When I was 13, I went to see my dad in the hospital as he woke up from what had almost become a full-blown diabetic coma. When he saw my family, he gestured for my brother to come closer, then whispered "The nurse told me not to lift large objects, but I need to use the restroom." Then he turned to me and said you are one big fat Mexican." Not a doctor, but I think I accidentally insulted one once when under sedation. Years ago I smashed one ankle but good. The hospital basically sedated me while they tried to align things and wait for me to get less shocky. I don't remember much of the afternoon at all. I do remember coming to just before surgery. There was this smiling man looking down at me. He cheerily chirped, as if he was explaining he'd be my waiter for the evening. "I'm Drive Pinto and I'll be your anesthesiologist." I remember thinking, "Pinto? Like the bean?" I think I said it out loud. I don't know. He must have been okay with it though. I came to pretty fast after surgery and didn't feel sick at all. He also gave me a shot in my hip, so I didn't need morphine or any pain meds for hours afterwards. I'm sorry if I said you were a bean, Drive Pinto. You're a great anesthesiologist, if that helps. Can I flip this around and tell you about the most disturbing thing I heard from an anesthesiologist when I was the patient? I'd just given birth to my first baby and my placenta wouldn't budge, so I had to have it removed manually. Gross, I know. The anesthetist gave me an epidural and stayed with me during the procedure. It wasn't the happiest time in my life, giving birth and being separated so quickly from my son. Also having someone rummaging around my uterus. Sensing my upset, this anesthetist decided to cheer me up by telling me all about the lost children of Francoism. These were babies stolen from their mothers soon after birth in hospitals. Oh, and did I know this went on into the 80s? He kept talking about for like an whole hour, going into great detail about the pain and anguish it caused the parents and the whole country. Babies spirited away without their mother's knowledge, they being told their child had died. Eventually I burst into tears and the surgeon told him to shut the hell up. He apologized and tried to make me feel better by saying it wasn't just in Spain, you know. These things happen all the time everywhere. I think he was a bit socially awkward and was just trying to make a connection. You know, me just having a baby and him having just read about stolen babies in the internet. I guess he thought I'd find it interesting or relevant, but still, it was pretty disturbing conversation to have with a patient. I sang the safety dance song over and over and over and over while coming to post-boob surgery. Didn't even know I knew the safety dance at the time. Then when my brother picked me up after, I was still singing it and trying to flash half the hospital. / My wife works GI, colonoscopies, actually just shared this one with me yesterday. Guy comes in and is about to go under. Everyone that works in my wife's clinic is female. Right before the dude goes under, he says to think, some people pay big money to get 3 pretty ladies to do this. Here I'm getting it for free. Today must be my lucky day. As a patient, as I was going under for a colonoscopy, I'm terrified I'm going to poop on you. As I was waking up from a surgery, I had a panic attack and started screaming how it was never going to end, and then went back to sleep. This happened about 15 years ago. I was putting a young guy, early 20s, to sleep for surgery. He was pretty rough around the edges. Obviously had lived a hard life, smoker, drugs, alcohol. Just as he's about to go out, he looks me dead in the eyes and slurs, "I wanna fuck you." Now I've had plenty of women get flirty after a little sedation, but this is the only time I've been propositioned in an aggressive, rappy fashion. I left him in the recovery room and never saw him again. My personal story: I got all 4 of my wisdom teeth taken out. When I started to come to, my whole mouth was numb and puffy. I don't remember if it was me or an assistant, but when the gauze came out of my mouth completely red from blood, I freaked out. Not because it was bloody, but because I thought it was my tongue. I don't know if I thought I bit it off or they cut it out, but I was convinced that it was my tongue. Clearly I was still out of it, and I'm happy to have my tongue still. I came out of anesthesia in a hospital dress. For some reason I decided I couldn't breathe. The dress was too tight and needed more air. I unlaced the front of it and let my boobs hang out. I sighed happily and stared into the distance, gently drooling. A nurse happened to walk by a minute later and offered to kindly adjust me after she saw an old man who was about to go into surgery gawking at me. I looked at her and slurred, "Sockage, probably the best thing he will see today." She chuckled and fixed me up anyway. I woke up in the middle of a neurologist trying to clip an aneurysm in my brain. I reached my hand up, grabbed the surgeon's hand, and said, "You're hurting me." Several staff, including the anesthesiologist, screamed like a girl. The doctor asked me where the pain was, and then practically shouted at the anesthesiologist to get her under. Afterwards the anesthesiologist came to apologize. He said it took 4 times the normal amount for a person my size, small, to stay out. The doctor told me I was crushing his hand with the probe in it, and that it took everything he had not to jump and stab my brain with the probe. They had never had someone wake up in surgery before. I was about to anesthetize an elderly female patient undergoing a hip replacement following a broken hip. I decided to do a nerve block in her groin before doing the main anesthetic, a spinal block, so she would be better able to be positioned for the spinal. I had to slightly lower her underwear, with prior warning and consent, to do this, and as soon as I did this, she exclaimed loudly, "That's rape." She was joking, but FML it was embarrassing. Medical student a few years ago on anesthetics placement. Was wheeling patient from theater to recovery with a consultant. He was still asleep, but just starting to rouse. Consultant starts asking me how Dropbox works. So I start to explain the concept when the patient starts mumbling, with his eyes still closed, something that I didn't quite catch. "Excuse me?" I said as I leant in closer. "Dropbox is really good," he muttered with eyes still shut. Another one, when you want to rouse patients from anesthesia you start by shaking their shoulder gently and asking them to open their eyes. This other woman had her eyes shut, but shook her head vigorously when the anesthetist asked her to open her eyes. Like how delicate is that line between consciousness and unconsciousness? My sister and I had our wisdom teeth removed at the same time. While waking up, our mouths still completely numb, we both shouted back and forth to each other, "Did you just say penis? No, you just said penis. You just said penis." And so on. Then I tried to tell the doctor he looked like Christopher Walken. I was a patient. I got my wisdom teeth out, and I had twilight sedation for the procedure. I remember drifting in and out of consciousness, and I really wanted the doctor to know that I was awake for it. I managed to ask for a pen and paper, because my mouth was full of gauze. I wrote, "I woke up during the procedure" on the paper. I showed it to the nurse and my mom. They had no idea what it said. I was irate. I wrote very carefully. So I did it again. Still, nothing. Years later, I found the scrap of paper. My mom's a mild hoarder. It was complete gibberish. Made up letters and words that had no meaning. I had a pretty funny one when in residency. Was at a very well-known children's hospital, one of the top 3 in the country, doing an elective month on top of the usual rotation. Went to see part in pre-op. She was 17 and very uptight. Made it clear from the get-go that she was a valedictorian, ahead of her peers academically, and was pretty bossy. I thought to myself, damn, what an arrogant little bitch. She was to have a procedure which for the anesthesia required was sedation with some local analgesia. Patients, and I guess everyone, have various means to deal with stress in an acute situation, ESP when they are looking at the relinquishment of control that being subject to anesthesia entails. So, when I brought her back to the OR, she couldn't stop talking about her academic achievements, how far ahead she was from her peers, etc. She already has started receiving medication by now, and is getting quite chatty, in a very self-aggrandizing way. We get her on the OR table, and after monitors in place, draping, etc., she is laying it on pretty thick. I could care less, whatever helps her get through the op. She is, after all, a 17-year in a scary situation. Then the following dialogue happens. "I'm graduating early, you know. Still going to be valedictorian." Me, "Okay, that's a big accomplishment. Congratulations. I'm going to travel. Travel to New Zealand." Me, "That's great. I know a few people who have been there. They did a B.C. About now the procedure is about to start, and they are about to inject the local, so I deepen the plane of anesthesia. Close bracket. Just can't wait to travel. You know how much pressure I'm under? Can't wait till I can get away from everyone who knows me, and I can do what I want. Because everyone loves a girl with a big set of tits." The whole room just pauses and looks at each other over the drapes, like, did I just hear that? Looks on their faces. And she goes on, "Because I've got a big set of tits, you know, and there are a lot of cute guys in New Zealand, and I'm going to get with a lot of them. No one there knows me. I can do whatever I want. And I'll come back for graduation like nothing happened." By this point, I'm pushing more propofol, and she's drifting deeper. I'm barely able to contain my laughter, and the surgeon is laughing his ass off behind the drapes. She does, however, have one last gem before she does. I want what I want. Don't judge me, hands down the funniest patient story I have ever experienced. For me, a few stand out. Before you are put under anesthesia, we often administer a small dose of a sedative to decrease your anxiety. Also, when we get to the operating room, we always confirm what procedure is being done, and the patient often participates in the discussion. One of my patients was having a small orthopedic procedure, but when asked to confirm this, he continuously insisted that he was having a penis transplant. Another time, after I woke the patient at the end of his procedure, he immediately demanded a hug from me, like as we are still on the table in the operating room. After waking up from sedation, to get my wisdom teeth out I asked the nurse, "Did you keep my teeth?" No. I really wanted to keep them. She kind of laughed. Why? Because I was going to sell them. They're worth money. My mother drove me home, and while I was waiting in the car, while she ran into the gas station, I watched two ducks fight for what seemed like 10 minutes. I've never seen that before or again. I was 21. Patient here. While waiting on the table for a general, I received some sort of pre-op sedative. The nurse says, "What do you do for a living?" I say, "Maths teacher." She says, "Oh, I was never very good at maths." I just blurted out, "Great, you're going to fucking kill me because you're too stupid to calculate ratios properly." Then I went out. I'm not an anesthesiologist, but I have had to have several colonoscopies and have woken up during a couple. The first time I remember waking up and looking at the screen for the scope, and I said, "Hey doc, that's not normal, is it?" Then I was out again. The second time I woke up again, looked back at the doctor while he was working the scope and said, "Hey, you didn't even buy me a beer." It seems like my body has a tolerance or something, because it never seems to last as well as I'd expect. Not a medical professional, but the patient. My first time being sedated/put under was when I was 28 and had my wisdom teeth out. We found out the hard way that, while propofol does make me temporarily immobile and feel no pain, it also does not knock me out. The oral surgeon didn't believe me until I was able to repeat back to him the conversation he and the nurses had had about a third party during my extractions. To them I looked conked out, but my brain was still 100%. It turns out my grandmother, with whom I share a blood type, if that matters, has the exact same reaction to anesthesia. She was fully conscious through knee replacement surgery and took her surgeon to task in recovery for calling her a fat cow, among other things. A story my dad often tells: there was an elder woman getting a colonoscopy under sedation, and when it started she said, "Harold, is that you?"